First of all, I would like to acknowledge Asada Thomas, the Executive Director of the Institute for Community Justice, which I understand works under the umbrella of an old friend and ally of mine, an organization I love very much. And that, of course, is Philadelphia Fight, including its iconic leader, Jane Schul, whom I've known for almost 30 years. It reminds me of some former people associated there, such as Kiyoshi Kuramaya, a legend. For those of you who don't know who he was and what he did, it's pretty amazing. Only one of the things he did was take care of Dr. King's kids after he was killed for a brief period of time, but he did so much. It's a fascinating organization. Being 59, going on 60 myself, when I hear so many passionate, intelligent speakers about justice, I think it's kind of nice to mix it up a little bit with the flow of history. And by the way, a shout out to Delta Sigma Theta sorority on behalf of one of its proudest members. I'd also like to thank Judge Stephanie Sawyer, whom I have known for many years and admire very much, Congressman Dwight Evans, Chief Defender Bradford Ray, with whom I work all the time. It's always good to hear what she has to say and her insight. And also Dr. Jacqueline Bailey Davis and Robert Salim Holbrook, who speaks so passionately and eloquently on behalf of the Abolitionist Law Center. I want to give some words of encouragement to those who are serving time. I hope some of you are watching as we are doing this presentation. And if you're not, I hope you have a chance to see it later. Special shout out to Man Up SCI Phoenix, specifically its co-founders Tyree Wallace and Anthony Benny Dew Sutton. These are two gentlemen I've met more than once, including when I went to SCI Phoenix to meet with Man Up. That was quite the experience. It was my understanding this is the first time that a DA did that for no good reason. DA should have been up there a long time ago. You know, just as I'm sure defenders and defense attorneys have been there, they should have been there a long time ago, because we all have to work together if we are to deal with the issues that confront us. Also, I'd like to let you know that under the umbrella of community engagement, and G. Lamar Stewart at my office is in charge of community engagement, I'd like to let you know that returning citizens who are members of Man Up SCI Phoenix, like Radhi Hammett, Tyree Little, and Michael Butler, are actively working with our community engagement unit to implement gun violence prevention programs for Philly youth and intervention programs for drivers of violent crime. So I said a little bit about history. I'm going to do the crazy thing here. I'm going to try to talk just some of the bigger thoughts that I think have hit me in the head over almost 60 years about what government is supposed to be and what government sometimes is not, and how even this conference, its sponsorship, what has happened to an organization like Philadelphia Fight, how even all of that relates. I don't know exactly how much time I have. I know originally we were scheduled for some time, but if I could, Asada, if you'd be kind enough to tell me how long you want me to talk so I know when to shut up, I will do that.
You have 40 minutes, sir.
Oh, I'm sorry, I couldn't hear that. Can you say it again?
Yes, you have 40 minutes.
Great, wonderful. Okay. So let's talk a little bit about government. What is government supposed to do? Well, if government is legitimate, then I suggest to you what it's supposed to do is to protect people. That is what it's supposed to do. Otherwise, why do we have it? So what happens when you have a government that, instead of protecting people, harms them? It harms them directly, or it harms them indirectly. What we have is a perverse and unjust system that harms the bodies of the people in it. Unfortunately, we in this country have a history of addressing people's health, even people's health epidemics, by pursuing, or at least allowing, the selective harming of people within our society. And we know who those people are. They are people marginalized in one way or another. They may be black, they may be brown, they may be indigenous, they may be LGBTQ. They will very often be poor. They may be suffering from mental health issues or addiction. And rather than protect them, what our government has done too many times, and certainly this is the history of my career, is it has harmed them or allowed their harm. This is a real bad idea for a whole lot of reasons. Just one of the reasons is that the nature of any epidemic, whether it is an epidemic of gun violence, it is an epidemic of HIV/AIDS, or it is a pandemic like COVID-19, the nature of any epidemic is that it spreads. The old system that we have had has tolerated government making sure only marginalized people got killed, whether directly or indirectly. That is not just immoral, it's also suicidal in the end. If you look, for example, at our history of HIV and COVID-19, that history proves that even as epidemics kill outsiders first, in the end, they are not as selective as the government might like them to be. In the end, epidemics harm and spread to everyone. Justice reinforces the truth that doing less harm to anyone's body, no matter how marginalized and how stigmatized that body is, does less harm to everyone. Many years ago, I was the attorney for certain things that ACT UP, one of the greatest activist organizations and most effective, in my opinion, around HIV/AIDS was doing. And then I had something to do with an organization called Prevention Point, which you may still know. I'd like to tell you a little bit about that because I think it brings us to where we are now. Just as Philadelphia Fight has gone from what seemed to be the narrow issue to the broader issue, I think it brings us to where we all are, the connection between public health, governmental failure, and justice. So the Kensington neighborhood in Philly has been Philly's epicenter of heroin use since at least the late 1960s, due in part to the relative purity and the low price of heroin available there, a byproduct of the neighborhood's proximity to seaports and highways, airports and train tracks, where drugs and the guns that come with them move up and down the East Coast. There are reasons beyond its geography why Kensington has been the epicenter of heroin for so long. Industry died there in the 1950s and 1960s, at first slowly, so that it degraded wages and drove out its population of what was white ethnic workers at that time. Then industry died completely, but only after a substantial population of Puerto Ricans moved here to work in the industrial plants there at the lower wages. When industry failed, that population was effectively stranded. And the next industry to arrive was the illegal sale of drugs, offering what became the area's only real economic opportunity in a neighborhood that remains desperately poor even by Philadelphia's standards. And Philly is a poor town, as you well know. I got to know Kensington in the late 1980s. I became an attorney in 1987 through my work as a public defender, and then later as a lawyer who represented Prevention Point, which was Philadelphia's clean needle exchange program that activists built in part to stop the spread of HIV/AIDS among intravenous drug users during the AIDS crisis. You notice I said activists built it. That's because government didn't build it. At a time when HIV/AIDS was devastating first a gay male population, a black Haitian population, and then a population of hemophiliacs who were dependent upon a blood supply untainted by HIV/AIDS, at a time when it was spreading exponentially, government did nothing. You had two successive presidents who wouldn't even invest in research. And why? Because the populations I'm talking about were marginalized, because government was not protecting them the way it was prepared to protect other people from other things. Drug users shared needles frequently during that time, spread the virus rapidly as they shot up 3 or more times a day. The needle exchange collected dirty needles and syringes and exchanged them for sanitary ones. The fact that HIV/AIDS was spreading through intravenous drug use, blood transfusions, and sexual contact meant we needed to simultaneously slow its spread and do the medical research that could offer a medical solution down the road. At that time, I saw no reason why criminal laws meant to protect us should place us in danger. But then again, who passes those criminal laws? It's government. My attachment to Prevention Point's work to fight the spread of AIDS by intravenous drug use, and the related work of ACT UP to fight the spread of AIDS through sexual contact and to fund research to find a cure was partly personal. This is the late 80s, the very early 1990s. I think Philadelphia Fight was founded about 1990. My sons were born in 1991 and 1993. Their births reminded me that the generation of children just arriving were seeing a world that was ravaged by a growing plague, and it was called a plague at the time, my generation had so far failed to address. And it was getting worse. AIDS was already devastating marginalized group and was daily finding more groups to slaughter, as many of you know. The history of HIV/AIDS is that the groups changed and shifted for a lot of different reasons. And eventually the group most affected during a certain period of time was actually African American women. So as I said before, when you have any kind of an epidemic, it does not know boundaries. It does not know a tribe. It will go wherever it goes. My generation's failure at that time to cure HIV/AIDS or to slow its spread meant that every human was or would soon be at risk. Intravenous drug use and insecure medical blood supplies were killing people, and so was mere sexual activity. If we did nothing for all of our babies, as teens or adults, they would unknowingly infect and eventually kill themselves and tens of millions of others without ever touching drugs, without ever touching a needle. They would all be at risk. As usual, our government was not acting to prevent harm that did not greatly impact its beloved insiders, but eventually would impact us all. At that time, under Pennsylvania law, there was, and I suppose still is, a simplistic legal argument that providing clean syringes and clean needles to drug users violates the law against disseminating drug paraphernalia, as it's called. But there's a better legal argument that providing clean syringes to drug users follows the law of justification. In other words, the law of self-defense or of protection of others. Justification is written into the law, and it allows us to commit a smaller offense to prevent a much greater harm, mostly when we are trying to protect ourselves or other people from suffering injury or death. In my view at that time, protection of others, everyone really, was the mission of Prevention Point and its clean needle exchange. Contracting or spreading HIV and suffering or dying from AIDS were terrible harms to be prevented by the smaller offense of giving clean needles to intravenous drug users. So in my view, Prevention Point's work was morally required and legally justified. But not everybody agreed with this analysis. Government didn't agree with this analysis, at least not at first. In the early 1990s, Pennsylvania's statewide prosecutor, the elected Attorney General, one Ernie Priate, railed against needle exchange programs like Prevention Point and suggested that he would arrest and prosecute the activists who worked for them. His comments were friendly to upstate conservative voters who were uncomfortable with basically everything about HIV/AIDS and everything about drugs and needles. Whatever they represented in their minds, well, they didn't want anything to be done for those people. Ernie Priate clearly had some interest in running for higher office statewide, perhaps governor, perhaps senator, as so many other state attorney generals have done before and will in the future. I believed at that time, and so did Prevention Point, and so did ACT UP, I believed that Ernie Priate meant business. We prepared for arrests and prosecution. But concern about the Attorney General subsided when he resigned his office after taking secret campaign contributions from video poker machine operators that he did not include in his finance reports. The former law enforcement chief reportedly told the press shortly before going to federal prison, quote, "I can do federal prison standing on my head," unquote. And then he proceeded to begin his 14-month sentence. So the threat of prosecution from the Attorney General subsided as he himself went away, in one of those ironies that's hard to forget. But Philadelphia police were initially unsupportive of needle exchange in a culture that still gave room to the laughable, unscientific notion that providing clean needles enables and increases drug use. Really? So teenagers only have sex because they have condoms? Seriously? Anyway, the Philadelphia police still rousted users who showed up at the card tables Prevention Point set up in Kensington under the elevated train tracks. Rather than get clean works, as they called them, the users got arrested for possession of drugs, or they had their clean needles and syringes stomped and broken by police shortly after they left the card table. But as time passed and public health information spread, the wisdom of stopping the spread of disease by providing clean needles gained momentum, with then Mayor Ed Rendell, and policing in Philly changed. The police began to leave the needle exchanges card tables alone. Over time, Prevention Point was accepted because it reduced harm in the middle of an epidemic. The people of Prevention Point did a lot to stop the spread of HIV, AIDS, and hepatitis C in Kensington, and therefore helped to stop its spread to everyone, everywhere. It is debated whether Prevention Point also reduced harm in Kensington by eliminating countless dirty needles from parks and sidewalks where everybody uninvolved in drugs walked around every day. And this debate continues today. In fact, I heard it not even 2 weeks ago in a meeting with a number of people from Kensington. Some neighbors still argue that Prevention Point supplies those needles but fails to require the dirty ones return in exchange for the new ones, as the phrase needle exchange signifies. Prevention Point's better resourced work continues even now, although under punches from some neighborhood residents who blame it and the absence of a second war on drugs after the first one failed. They blame it for their painful daily struggles with the addiction and misery that surround their homes and that affect them and their families daily. Prevention Point saved a lot of lives, but it did not end Kensington's problems. Sadly, it is almost invisible to the current residents of Kensington and to many people in our society. The incredible wave of disease that was avoided and prevented, and avoided for everyone in the population by virtue of actually giving out these clean needles, by virtue of individuals, activists, organizers challenging government and somehow pushing back on government, winning over government. We cannot even imagine the extent of the viral spread that would have occurred if it wasn't for all of these years of those needles being provided. And so we find that our discussions and our arguments come down to things that are obviously bothersome and serious, like dirty needles in the street. But we need to remember what, fortunately, we cannot now see. The truth is that heroin use is now worse than ever in Kensington, thanks to the massive and reckless distribution of opioid pills by doctors due to the aggressive false marketing of big pharmaceutical companies and a bought and sold U.S. government. You notice I came back to government. Government's failure to protect us. Our government thinks it's okay to have 4 times as many opioid pills as we used to have. They think that's okay. And in so doing, they are doing what government should never do, which is to fail to protect us. The U.S. government has allowed the quadrupling of the U.S. pill market over more than a decade, while other and healthier countries have reined in Big Pharma's capacity to flood those nations' markets. American doctors were actively misled, or worse, maybe even cajoled and bribed, into catalyzing heroin addiction as they stuffed their patients' hands with opioid pills they medically prescribed. Think about that for a minute. You have an explosion in opioid use, and the first drug dealer is a medical doctor who doesn't know better. Of course, you're going to have this explosion of use that we are experiencing here. You're going to have it among people who are working construction jobs and get injured. You're going to have it among athletes who have taken care of their bodies their whole lives, but suffer an injury and are told by a medical doctor, this is okay, you can take this supply of pills. Now the United States consumes approximately 3/4 of the world's supply of opioid pills, while other countries with long-standing heroin problems have turned those pills away and are no worse off than before. For years, doctors and dentists have routinely written opioid prescriptions, and you all know this, for a broken wrist, for wisdom teeth that are removed, for bariatric surgery. According to the Center for Disease Control and Prevention, which used to be more credible than it is now, but still, when they said this was credible, 20% of patients who take a 10-day prescription of opioids become addicted. For some people, the addiction starts the second day of taking pills. And once the prescriptions expire and doctors refuse to write more, people who are suffering addiction resort to street heroin. But street heroin, which is increasingly laced with fentanyl, a highly volatile and unpredictable anesthetic of such intense potency that tiny amounts are fatal, especially when they are roughly mixed with heroin or cocaine and crack by drug dealers rather than chemists. This heroin mixed with fentanyl is more fatal than ever before. Fentanyl makes drug dealers more profit while placing their customers in even more danger. It is involved, based on the last data I saw in Philadelphia, in 70% of fatal overdoses in our city. And Philadelphia is among the worst jurisdictions in the United States for its rate of fatal drug overdoses. By comparison, New York, which is 5 or 6 times larger than Philly, has about the same number of fatal overdoses per year as Philly. More than 1,000 people die from fatal drug overdoses each year in Philly. More than died of AIDS per year at the height of the AIDS crisis here. The highest number that I recall was, I believe, 900. It was either 942 or 924, but it was a number like that. That is 3 people a day. One dies. You know what I'm going to say. One dies every time you have a meal. So how do opioids kill? And how does it connect to this topic? Opioids of all types kill primarily by suppressing breathing. Users nod off, sometimes when their necks are in a position that restricts air. For this reason, experienced opioid users often take drugs with other users nearby to be their lifeguards. Sadly, the other users are often impaired themselves and may be simultaneously injecting the identical, potentially fatal mix at the same time. Opioid users who fatally overdose overwhelmingly die alone, behind dumpsters, or in their bleak homes, or in the bathrooms of fast food restaurants or libraries where nobody sees them. For many, addiction is self-medication for mental or severe trauma, mental health issues or severe trauma in its many forms, rape trauma, abuse, or the weighty accumulation of terrible experiences in childhood that correspond directly to criminal conduct later, especially when they go untreated. In recent years, many newly addicted people are simply injured athletes or construction workers who trusted their doctor's prescriptions. The DSM-5 says substance abuse addiction is a mental disorder. They call it substance use disorder. But unlike other medical problems, our culture considers addiction worthy of blame. And so, yes, we have yet another group of outsiders, of marginalized people, of people our culture stigmatizes, and ultimately that stigma has its consequence. There's plenty of blame to ascribe to profiteering medical companies, medical providers, and drug dealers, ineffectual and financially compromised government that fails to protect us. We have a punitive criminal justice system so wrong-headed that its program of mass incarceration resulted in more drugs and more addiction than ever before. Go to jail and you will be massively delayed in getting treatment for addiction, if any is available at all. There's more access to treatment on the street, woefully inadequate though it is. We should be outraged, especially when we consider how other countries have avoided our current crisis simply by limiting access to opioid pills and adding low barriers to treatment for those who are suffering from addiction, including by providing national health programs. Coming back to government, what is going on with our government? What's going on with our Supreme Court right now when it comes to a relatively expansive, relatively national health program? It hangs in the balance, as you well know, where the Supreme Court and our current leader of our government are trying to destroy it once again. Instead of being outraged by that government, much of our outrage is directed at the person who suffers the addiction, whose daily experiences fear and stigma that erode any feeling in them that their lives have value. So they hide from our government and its police and its prosecutors, and they shoot up alone behind a dumpster or in an apartment where they die with great frequency. Stigma kills them, and we are all the source of that stigma. This came home to me not that long ago, I guess about a year and a half maybe. Our office has made a real priority of recruitment, of trying to bring amazing law students from all over the country, from about 30 different law schools, including every HBCU law school in the United States, so that we can have the kind of excellence and the kind of diversity of all types, and I do mean all types, that this office should have had a long time ago. And part of that involved traveling to different law schools all around the country. There was something that happened in 2018, I guess it was, when I visited Fordham Law School that I just want to tell you about, because maybe it makes the point better than what I've done so far, hopefully. So in the fall of 2018, a law student left a message asking me to participate in a panel on harm reduction and supervised injection sites that would take place the next February at Fordham Law School. I said yes, although I never spoke to the student. A few months later, I drove up to Fordham. On the way, I read the bio of an assistant dean at the law school, Fordham Law, who had supported students in organizing the conference. She'd lost her son to opioid overdose in 2016 and had started a foundation focused on drug policy in his name. When I entered the Fordham Law building for the 6:30 p.m. panel, I noticed a large foam board announcing a memorial service that day from 5 o'clock to 6 o'clock p.m. for a second-year law student whose name I remember as Danny Young. The blown-up photograph of this young man showed an athletic, smiling, handsome kid. Well, kid to me, I'm 59, but kid. I went inside to check out the venue for my panel. As the memorial service ended, across the hall, around 6, some well-dressed relatives of Danny Young began to drift into the reception room. I didn't know why they were attending the panel. When I welcomed them and offered condolences, several of them said that Danny would have loved to attend. Eventually, another student told me Danny Young was the one who called my office. Danny died of the overdose. Panel started. I sat next to a medical doctor, PhD, in her 30s, who was wearing jeans and a black t-shirt with white letters that said naloxone. Naloxone is the brand name of an overdose reversal drug. She was this little, punky activist doctor, reminded me very much of the old crowd in ACT UP, or maybe some of the doctors who work with Philadelphia Fight right now, my kind of people. I looked out at this large crowd seated in the front row, just about 8 feet away. Facing me directly was a tall woman, my age, dressed formally. She's holding upright in her lap a framed photograph of Danny Young. She looked just like him. And so did the rest of the row of people, the sisters and brothers and father. So the panel hasn't started, and now I got to talk to all these people, and his picture's right there, which was not easy. I heard they were Canadian. I could barely look at the woman or the portrait. Funny thing is that in Vancouver, Canada, where he was from, they have supervised injection sites. But there weren't any of those sites where he had gone in New York City, at least not officially at that time. I had been to Vancouver supervised injection sites. I had seen them, and I knew what they were. Some people call them safe injection sites. I do not. Others, wary of the notion that injection of hard drugs should ever be called safe, call them supervised injection sites. I call them harm reduction sites because to me, that's what they are. Harm reduction is the thing I think government should do because government should protect us. And that means reduce the harm that comes to us either directly by doing directly what happened to Breonna Taylor or indirectly by doing things like protecting us from epidemics that disproportionately affect marginalized groups of people. The thing about these sites, though, whatever you want to call them, is that no one dies there. No one. Since 2003 at least, no one dies in the ones activists started in the United States where they are underground and illegal. No one dies in them, although hopefully soon in Philly there will be one that is not underground and not illegal. No one dies in them in Canada or Germany or elsewhere where they are legal. No one dies in them when they are run by idealistic doctors and med students or when they're run by scruffy activists. Most people who first hear of these sites conjure up images of medical doctors or maybe other drug users providing drugs and helping to inject. That is not the case. There's a roof, there is heating and cooling, bathrooms are available, opportunities for treatment are always available and encouraged when people who use the sites are ready to hear it. Excuse me. I visited one site that had a detox facility upstairs, literally upstairs. You could take an internal staircase up at the back, and offered help in other forms, advice on obtaining benefits, copy machines, coffee, sometimes food, clothes washing machines for people who are often homeless and whose daily grind is to avoid the physical and mental agony of coming off a drug that was fun only the first time. I saw a picture of Johnny Cash on the wall of this supervised injection site, who accomplished so much even though he struggled with addiction until the end of his life. There was a picture of Keith Richards on another wall, another musician who had a long struggle with addiction. There were people, some who were once addicts themselves, who were just there to listen. Yes, these sites do reduce harm to drug users, and they do more. By saving drug users' lives, they reduce harm to their families and to their communities. Dirty syringes are disposed of safely as medical waste inside red plastic sharps containers inside the sites, rather than being left on sidewalks and in parks. Users inject indoors and in private, rather than in public for children to witness on their way to school.